Rubella German measles or 3-day measles is a mild disease, skin eruption or rash occurring as a symptom of infants and children that is typically more severe and associated with more complications in adults. This disease is often mild and half of people not realizing that they are infected. A rash may start around 2 weeks after exposure and it lasts for 3 days. It usually starts on the face and spreads to the rest of the body. The rash is sometimes itchy and is not as bright as that of measles. Prodrome period before symptoms occur, consisting of low-grade fever, sore throat, red eyes with or without pain, headache, malaise, anorexia, and lymphadenopathy begins. In children, the first manifestation of rubella is usually the rash, which is variable and not distinctive. It begins on the face and neck as small irregular pink macules that coalesce, and it spreads to the torso and extremities where it tends to occur as discrete macules. Swollen lymph nodes are common and may last a few weeks. A fever, sore throat, and fatigue may also occur. The duration of the rash is generally 3 days, and it usually resolves without discoloration, without skin peeling. Subclinical infections are common. About 25 to 40% of children may not have a rash. Teenagers and adults tend to be more symptomatic and have systemic manifestations, with up to 70% of females demonstrating arthralgias and arthritis. In adults, joint pain is common. Complications may include bleeding problems, testicular swelling, and inflammation of the nerves. Infection during early pregnancy may result in miscarriage or a child born with congenital rubella syndrome. Symptoms of congenital rubella syndrome manifest as problems with the eyes, such as cataracts, deafness, as well as affecting the heart and brain. Problems are rare after 20th week of pregnancy. In pre-vaccine era, rubella appeared to occur in major epidemics in every 6 to 9 years and was most common in preschool age and school age children. The endemic spread of rubella was declared eliminated in United States. However, worldwide in 2016, 22,000 cases of rubella were reported. Diagnosis. The most common diagnostic test is rubella immunoglobulin M, IgM, enzyme immunosorbent assay, which is typically present after 4 days after the appearance of the rash. Prevention. Rubella infections are prevented by active immunization programs. The WHO recommends the first dose be given at 12 to 18 months of age, with a second dose at 36 months. Pregnant women are usually tested for immunity to rubella early on. Women found to be susceptible are not vaccinated until after the baby is born because the vaccine contains live virus. Differential diagnosis. In severe cases, it may resemble measles. The absence of Koplik spots and a severe prodrome, as well as short course, allow differentiation from measles. Other diseases frequently confused with rubella include infections caused by adenoviruses, parvoviruses, B19, erythema infectiosum, Epstein-Barr virus, enteroviruses, roseola, and mycoplasma pneumonia. Complications following postnatal infection with rubella are infrequent and generally not life-threatening. Post-infection thrombocytopenia occurs in approximately 1 in 3,000 cases of rubella and occurs more frequently among children and in girls. Arthritis following rubella occurs more commonly among adults. Encephalitis is the most serious complication of potential rubella, but it is rare. Treatment. There is no specific treatment available for either acquired rubella or congenital rubella syndrome. Supportive care. Postnatal rubella is generally a mild illness that requires no care beyond antipyretics and analgesics. Intravenous immunoglobulin or corticosteroids can be considered for severe non-remitting thrombocytopenia. Reinfection is possible both individuals who were previously infected with wild virus rubella and vaccinated individuals, but it is rare and have mild symptoms.